What are the signs and symptoms of stroke? As I mentioned earlier, how will you be able to spot a stroke? Now, spotting a stroke, we usually use the acronym B FAST. B meaning balance loss, E means eyesight changes, F means face drooping, and A means arm weakness. Now, S also means speech difficulty, and T means time bound, meaning time is brain. Now, for loss of balance, eventually the person cannot be able to walk straight. He starts having some gait abnormality. Either he starts having staggering gaits, having some imbalances in movement. Secondly, he starts having double vision. The eyes, he cannot be able to see clearly. The vision becomes blurred. And thirdly, the face starts drooping. Certain part of the face, such as the mouth, starts shifts to one side of the face and drops. The arm eventually gets weaker and the speech becomes slurred. And then all these events, whenever it arises, we all need to act first. It means we should act first. That's what we say is time bound. And it's a time for you to call 911. It's time for you to respond to emergency. What are other symptoms and signs of stroke? The other symptoms or signs of stroke include headache, vomiting, seizures, dizziness, dysphagia, diplopia, neck pain, neck stiffness, and urinary incontinence. What do all these things mean? When someone starts having stroke, before the person starts having headache, before the person starts having projectile vomiting, before the person starts convulsing, sometimes the person can feel dizzy. And when this eventually arises, the person will now be unable to swallow. When they're having difficulty in swallowing, the person also will start seeing double, and the person's neck can be paining him, but the person cannot be able to turn the neck becomes stiff. Sometimes the person starts urinating on himself, which is what we call urinary incontinence.